Hi, this is Dr. Suman Bijlani and you're watching me on Sify.com.
As an expert, what tests and procedures do you recommend in pregnancy?
The first thing I'd like to say that in pregnancy, the best thing to do is to start the procedure before pregnancy. That means I recommend pre-pregnancy counseling very, very strongly. Okay, and once you're already pregnant, please go to your gynecologist immediately. Don't wait for the 5th month or the 7th month. In the first trimester itself, that means in the first 3 months itself, we recommend a lot of tests to rule out sugars, that is your sugar test, that is to rule out diabetes, thyroid tests, and also of course infective profile, that means whether you have any infections or not. We have to do sonography at different intervals. So we do a sonography in the first trimester, then we do one in the 3rd month, then we do one in the 5th month. That is called the anomaly scan, where we check your baby to see if there are any defects in the baby. So these are tests which are absolutely mandatory and you cannot miss them. Apart from this, your gynecologist is going to offer different tests depending on your own reports and your own medical profile. So if you have some problems, there may be many more tests you need to undergo. Or if you are completely healthy, maybe these will be the only tests which you undergo. And then later on, you may need more sonographies as and when required.
How does age affect a woman's ability to have children?
Technically, any woman can conceive throughout her reproductive age group. That means from menarche, that is from the time that she gets periods, and right up to menopause. But after the age of 35, a woman's fertility goes down. That means she has lesser and lesser chance of getting pregnant. Apart from that, also women with older women have a higher risk of getting babies with birth defects. There is also an increased risk of miscarriage as age increases.
Can you please emphasize on the following? Laparoscopic surgery.
I'm sure everybody is very familiar with this term now, but let me clarify what it is all about. Now, when you open somebody's abdomen to do a surgery, it is known as an open surgery. But when you do the same procedure by using instruments going in through tiny, tiny holes made in the abdomen, that is a laparoscopic surgery. So what we do is we put in a central port or a hole opening where goes in the main camera, which is connected to a TV monitor. So everybody in the operation theatre, including the surgeon, can see what is going on inside the abdomen. Then you, depending on the case, put in more instruments from tiny different holes at different sites in the abdomen. Usually you need 2 or 3 more instruments, and you can do the procedure with those instruments. Now, one thing I want to say about laparoscopic surgery is that it is very, very convenient in the sense, you can get up and move about very soon after the procedure. There's hardly any pain. You recover faster. The surgeon is not putting his or her hands inside the abdomen. The abdomen is not open for a long time, so you have a very less chance of getting infections. But all said and done, the surgeon has to be expert. And also, not all cases are completely amenable to laparoscopic surgery. So you have to do a proper selection of cases.
Hysteroscopic surgery.
Hysteroscopic surgery means operating within the uterine cavity. That means what we do is we go from the vagina and into the cervix and right into the uterus using a telescope. And then we see what's inside the uterus and we operate within the uterus. Now the uterine cavity is very small. So we have to fill it up with some medium, a fluid, maybe some kind of a fluid or a gas, so that we can see everything clearly and then operate. This surgery has absolutely revolutionized gynecological treatment, because earlier, you had to cut from above and go right inside the uterus, and now you don't have to do that. If there's any problem within the uterus, you have a septum, a partition, or any kind of a fibroid within the uterus, you can actually go from below and remove it without any incision outside.
IVF technology.
Okay, IVF, I guess everybody knows it's test tube baby. Now here the thing is, there's this couple who's not able to conceive. Most of the time the indication for IVF is blocked tubes. So if the woman's tubes are blocked, the semen, that is a sperm, cannot reach the egg. So what we do is we physically bring the two together outside. So what we do is we take the husband's semen, we prepare it using certain chemicals and media, and what we do is we take the woman's egg. We first make sure that she develops many more eggs so that the chances of conception are higher. Then we aspirate, or rather we suck out those eggs, and together we bring both of them together in a petri dish, and then once they unite, that means fertilization has taken place, then the fertilized egg is reposited back into the lady's womb, and then she can carry it and hopefully she gets pregnant. I want to say this now, technically it sounds like everything is done perfect. So now obviously 100% she has to get pregnant, but no, that's not the case. About 35 to 40% of women do get pregnant, and a lot of it depends on, many factors are there which medical science has still not understood. So there are many reasons why many women, in spite of doing all this, still don't conceive.
IUI treatment.
IUI actually stands for intrauterine insemination. Here what happens is the husband's semen is prepared using certain media. So the husband has to ejaculate outside. We take a part of the semen, we mix it with certain fluids, we make the sperms really fast, very motile, and then we take a catheter, that sample in the catheter, and then inject that semen directly into the lady's uterus. Now what it does is that it bypasses the cervix, that is the mouth of the uterus. So there are some women who have a lot of cervical infection, so they benefit from this. There are husbands whose sperms are not very motile, so the swim-up technique helps, to make the sperms more motile. So these are the women who definitely benefit, but you have to have perfectly, open fallopian tubes. If your tubes are not open, IUI is not going to work for you. And the percentage of success of IUI is about 15 to 20%.
Surrogacy.
Surrogacy actually means lending out or renting out your womb. So what happens here is that a couple is not able to conceive, and there is this woman who says, you can use my uterus and I will carry your baby to term for you. Now what happens is there are some women who are actually born without a uterus. There are some women who have had to have a uterus removed because of some problems. And there are other women who, have some medical conditions because of which if they get pregnant, their life may be in danger. There are women who keep on aborting frequently, so they are not able to carry their babies to term. So surrogacy helps these women. It is not so common, but yes, it is definitely giving hope to a lot of women who are not able to conceive. I want to say one thing about surrogacy, that surrogacy has a lot of legal and ethical implications. I mean, it's very obvious that the genetic parents are different, and the mother who's carrying the baby is different. So the mother and the baby may bond. It may happen that after delivery, the surrogate decides that, no, I don't want to give up my baby. This is my baby and I want to take it home. So you have to have a contract which is drawn, and the parents who are intended couple, they are the parents to be, and they have all the right over the baby. Certain complications can arise if, during the course of tests, one finds out that the baby is abnormal and, you need to do an abortion. And what if the surrogate says, no, I don't want to do an abortion? So, so these things are there. So, surrogacy is definitely surrounded by a lot of ethical and legal implications. But yes, we have laws to take care of that.
Fibroids.
Fibroids are tumors of the uterus. I want to tell you a few facts about fibroids. One is that fibroids happen or occur only to women in the reproductive age group. That means only after she starts menstruating and up to menopause. Fibroids grow during that period as well because of the hormone estrogen which is there in our body. Fibroids are benign, that means they are not cancerous. They grow at will, and there is really no medicine which can, cure fibroids. So most of the treatment that we do for fibroids today is surgical. That means you either remove the fibroid if it's causing problems, or you just remove the entire uterus along with the fibroids if you've completed your childbearing, you've had your enough children and all, and now you say, no, I don't want to keep the uterus as well. Fibroids don't need to be removed unless they are causing problems. Most of the time what they cause is heavy bleeding, pain during periods, or pressure symptoms. It's a very large fibroid which is pressing on your urinary bladder, so you have to go and pee again and again. So these are the kind of symptoms it may cause. It may also interfere with fertility, if the fibroid is, very low down, interfering with the cervix, or if it is near the tubes, blocking the fallopian tubes, or if it is within the uterine cavity or very large, so it may also interfere with conception. These fibroids may also have to be removed.
Polycystic ovary.
Polycystic ovaries are becoming very, very common nowadays. I would say it's a lifestyle disease. It's happening because more and more fast food is being consumed, women are getting more and more obese. So now the reason for that is not known. And most of the time patients come and ask, why me? Why am I getting polycystic ovaries? It's not because your mom had it or your sister has it. It can increase, of course, a familial tendency is there, but it's mainly because of a lot of stressful lifestyle as well. What I want to say is most of these women have delayed periods. Okay, you may get periods every 3 months, 4 months, 6 months, or only when you take the tablets. They start putting on weight. A lot of them start developing acne, they have lots of pimples, or they may start developing extra unwanted hair on their face. And later on it can lead to problems with fertility because your egg is not growing right. You have tiny cysts on your ovaries, and the egg, which is actually, you're supposed to form one egg which grows, ripens and ruptures during a cycle. So polycystic ovarian women do not have that thing happening regularly. So they may ovulate once in a while or may not be ovulating at all. Now the treatment or the message for PCOS women is maintain an ideal body weight as far as possible. It is definitely more difficult for you to do so, I agree, but you have to put your heart into it, and once you commit and you can bring your weight down, it really helps a lot with the treatment, including everything. Your cycles improve, your acne improves, your ovulation happens, and you may get pregnant also. And it's a lifelong thing that you have with you, so you need to really take care, or rather manage your lifestyle throughout in order to prevent future complications.